Have you seen the number of porters change at all in the number of altitude?
Yeah,
Better,
changes
worse,
going up.
same?
Yeah.
How come you think?
Well, I guess maybe more and more lowland Nepali porters are coming up. Nepali people are coming up here for the job, for porters. Like in the old days, the trekking patterns has been changed. In the old days, not many people. The trekkings are mainly like sort of more up in the Kalpata town or Kojo up. Not many in those 3 passes or 4 passes or those ones. So in that case, a lot of the local people, they used to take the zopjok on trekking. But now trekking patterns have been changed. A lot of people come to cross those 3 passes, and the passes are not. The passes are not for the animal, and animal cannot cross those passes there. So people, the trekking group, they tend to take more human like porters than those animals, and as a result, a lot of London. And then we had this political problem in the back, like the last 10 years, and as a result, a lot of lowland Nepali people came up here for the job.
What do you mean by the political problem?
The Maoist, but they had problem down there at home. The young people in the Maoists sort of insisted them to come with them, so that this is the good place to escape. There are many, especially the Rai is particular ethnic group, Rai. Like they are mainly from about 3 or 4 days walk down in the south of Lukla. There's a big area. Majority of them, those people are from that region.
So the majority of the porters that you treat here are Rai?
Rai is right. 90%, 85% are Rai.
What are the most common injuries that you're seeing in the porters as they come down here?
Mainly the acute mountain sickness, and then just the normal, just the respiratory tract infections and acute gastroenteritis like diarrhea and vomiting and pulse and injury, broken bones.
What are some of the challenges you find here trying to treat haze, HAPE, AMS, altitude illness versus if you were in clinic or a hospital elsewhere with unlimited supplies? Are there any specific treatments that you find you have to do differently here because you're not in a huge hospital?
Of course, well, the only challenge is like Kathmandu is the only referral center, and if we cannot treat here, then Kathmandu is the only referral center. So sometimes because of the weather, sometimes because of even for the trackers, sometimes they don't have medical insurance, corporate, they don't have the money. That is the bit challenging one.
Looking forward, 10, 15 years into the future, do you predict any changes in altitude medicine and in the way it's playing out here in the Khumbu?
Altitude among the trackers is not going. Altitude sickness, the prevalent or incident, whatever, among the trackers is not going up compared to the number of increased number of trackers visiting this year. Last year, 32,000 people visited this region. I'm not really sure. This is partly because I think it's certainly because I think educations, informations, all the tracking agents, through the tracking agents, and all this, there. But not only that one, because the transportations and communications is so good that when they are sick, they call a helicopter. Now there are 3 helicopter companies. They're quite busy there compared to old, like in about 10 years back or so, only 1 helicopter company there. But altitude among the lowland Nepali porters are going up, and it's really hard to address. These people are illiterate. Most of them, they are from like a Bung area, like 3 days walk down from down in the south of 2 or 3 days walk down the south of Lukla. They during the off season they go home and they work in the field. Then as soon as they know that this is the trekking season has started, they just come up, and they are illiterate. Any information won't help much. So the only way is like the trekking guide take more care or a bit more aware of those aware of the porters, the health, porters' health.
Is there any push towards trying to create laws or stronger advocacy?
I'm not really sure. They have
or-
the International Porter Protection Group. They have information center down in Lukla. I stopped several times there, but each time when I went there, there's nobody there. I don't know how many porters will use it
Who
and how
need
many
it,
they will
yeah.
need it there. So, but there's no. Ideally, they need like somewhere in Manzo, where a lot of porters are passing through there, and because Lukla, like people fly there, and all the porters, we probably saw this group like big, like a lot of porters are there fighting each other. Then they suddenly disappear with their load, and so I think they really need somewhere in the Monzo. This is the past night, so this is the place with this around the Monzo or Doctor where they stop the past night. So
Does it seem like those porters that have been educated realize it's like, do you know the story of the tortoise? and the bear?
again, you are right, because they come home, they came here for the money, and so and I think that's the one reason why they get sick, is they don't really admit that they are sick, so they carry on and on, and then until they collapse in the one side of the track, because they are worried that they might lose the job. So this is hard. That's very complicated and hard. So I'm sure maybe some trekking guides, like they are aware and they are very careful with those. But if they don't admit, then if they don't say that they are not a headache, and they're always slow, because it's quite hard to say. They're carrying like 30 kilos of load, and they're always slow. And so, but if they don't admit that they are sick, then it's hard.
Do you have any sense if those porters that have gotten sick once or that have been educated, that they've changed their habits?
No, I don't think so.
No, they just-
That's just, yeah.
Why is that,
Yeah.
you think?
I asked several times whether these porter had been told or had been told about this, or get some sort of education from them. They said no.